My journey through this cardiac surgery really began with a problem I had with my hips in late last year, and was going to result in some minor surgery. When in for the pre-op testing for that surgery, they discovered that my long-believed minor heart murmur was really a severe aortic stenosis.
At Catholic Health, we're able to be there when the patient needs us, no matter where the patient is in their life, as well as throughout the continuum of an episode.
Continuum of care here in Catholic Health means that we look at the whole person. We have services for newborns and pregnant moms and families right through to services for the aged. So that works from the continuum of care then is for your whole life. We seek to be the health care provider for a whole family, multi-generational.
I wanted to feel a human experience. I wanted to know that the people that were going to be holding my life in their hands had some sort of a personal connection, that I wasn't just a number.
High-performing healthcare, high-performing health system is about delivering the right care at the right time in the right location. And we have an ability, because the continuum of care of Catholic Health has those locations of care as close to the patient as possible, that the continuum is real in Catholic Health.
The more I looked, the more it became clear to me that rather than searching all over the Northeast, that the best solution was right here in Buffalo, with Buffalo Mercy.
Sometimes you might have the impression that because of the Catholic system's long-term commitment to serving the poor, that there might be the understanding that somehow the medical technology might not be as good as other facilities, whereas it's exactly the opposite.
Some of the examples of the high-tech interventions that are available within Catholic Health include state-of-the-art minimally invasive procedures, both minimally invasive cardiac procedures, minimally invasive GYN procedures, and minimally invasive general surgical procedures, where we are able to use the tools that we are blessed with at Catholic Health and we've invested with in Catholic Health to bring state-of-the-nation care to the community of Western New York.
Minimally invasive surgery and laparoscopic surgery is very beneficial to the patient, mostly because it minimizes their scars. So it's not only a cosmetic benefit, but truly they experience less pain, a much quicker recovery, a shorter hospital stay, quicker return to work and productivity.
What we can never do is compromise on the quality. The quality has to be outstanding, and that's the goal that each and every one of our associates at Catholic Health have every day, a commitment to quality, compassionate care.
As a care coordinator in an office, my job is to provide delivery of healthcare to patients with diabetes, congestive heart failure, and coronary artery disease. We use evidence-based medicine as well as patient education, coaching, and follow-up with these patients to basically educate them on their disease state and try and keep them out of the hospital.
Catholic Health, through its affiliation and partnership, if you will, with Catholic Medical Partners, has a unique alignment in a healthcare world that isn't really well aligned yet.
I think it's very important that there's communication between the hospitals as well as the physician offices. We have to look at ourselves as a team. We all have to work together, and our main goal is our patients.
They say that nationally there's about 25% of doctors' offices have electronic medical records. Here in our system it's about 75%.
Catholic Health, in its partnership and alignment with Catholic medical physicians, understands that the next iteration of healthcare in this nation is going to be around a value proposition, and that's delivering what the patient needs when the patient needs it.
We don't live with the patients on a day-to-day basis. We can't get them to change their diet. We can't get them to take their medicine. But if we can give them the tools they need, the education they need, maybe we can make a difference. Maybe it's only one patient, maybe it's 10 patients, but we can make a difference.
The team at Buffalo Mercy was extraordinarily efficient. Every step of the way, very efficient, a lot of great communication, very direct, and I never felt that my needs were being made secondary.
Part of the national reform for healthcare is an effort to control costs. And so technology is an important part of that. The Catholic system has invested a significant amount of dollars into the latest, greatest technology in order to reduce cost, improve efficiencies.
So if you're investing in this new technology to offer patients something that will allow them to have a quicker recovery and a shorter hospital stay, then certainly that is making the system more efficient.
Disease management is more of a proactive way of caring for our patients. We're able to take care of them sooner and try and prevent hospitalizations, prevent ER visits. Keeping patients out of the hospital is definitely saving time and money.
The technology is important not only in enabling the communications to occur across the continuum, but it also allows the more efficient use of information or efficient use of time.
Once I finally woke up after the surgery, roughly, say, 10 hours after the surgery, I was greeted by the staff at the cardiac care unit, and for the first 24 hours, there was somebody at my side virtually constantly.
So we just don't hire people because of medical abilities, because of their background and training. We hire professionals at every level in Catholic Health that are committed to the mission of Catholic Health. The mission of Catholic Health is really very simple. We see ourselves as continuing the healing ministry of Jesus.
There comes a moment as you're going through this process, and it really is one, because you're making decisions that are ultimately going to determine how or whether you're going to live the rest of your life, or how long it's going to be anyway. And while you know that intellectually, and you know as you're about to roll into the surgical wing that this may be the last time you're saying goodbye to your loved ones. It's not until you wake up and you look around you, you feel how vulnerable you are. You see your loved ones there again, and suddenly you realize you're a pretty darn lucky person.
At Catholic Health, there is a commitment to mission, and it's as much a commitment as it is a passion to the mission of achieving the best outcome for the patient, the right care at the right time, in the right place. And the people are as instrumental in getting us to that goal as any of the other tools are that we can use.
I'm sure that my great fortune in being able to live what I believe is going to be a long life is directly attributable to the incredible staff and the incredibly talented surgeon, the skill of the perfusionist, the anesthesiologist, and the entire care team. And I can't think of a single thing that I would change. in the care that I got from Mercy.